Good afternoon, everybody. Welcome and thank you so much for being here with us. My name is Florence Godry Perkins, and I'm the founder of an organization called DHP, Digital Health Partnerships, and I'm a passionate advocate of digital health, have been for many years, and I'm thrilled to be moderating the session today, especially on this very subject we're going to address, because I'm convinced, like many people in the ecosystem today, that this leadership and governance subject at the national level, at government level, is absolutely key to scale digital health, for digital health to begin to have impact. It really is an essential brick, this leadership and governance subject to scale. And I think this notion has become increasingly important, as there's a great need to build core systems and platforms as well as harmonization in the space of digital health, which is very, very fragmented still. And the digital health ecosystem has truly shifted, I think, in the past year or so with this growing realization. And there was an important report last year, not the only one, but I would say this one truly did have an impact in this shift happening. And it was released by the Broadband Commission Working Group on Digital Health. So with no further ado, what I'd like to do is to introduce you to Anne Hertz, who's sitting to my left, who is the head of the Novartis Foundation, who actually co-chaired this report and this work with Nokia. I don't know if Nokia is, yeah, they mentioned that they had a constraint. So, and so just a few quick words about Anne before I let her present the findings of this report, which will be a nice way to set the scene to this conversation we're going to have today. She started working with the Novartis Foundation in 2013 and has had a very rich professional path where she worked for many, many years as an emergency doctor here in Africa. So you have a lot of on-the-ground experience. Worked at the Red Cross, the Lung and Tuberculosis Association, held several positions in the pharma industry, but always with this passion for global health, in fact, and you published quite a bit, and you were elected in 2014 by Farm Voice as one of the 100 most inspiring people in the life science industry, which should be said. What I can also say is that Anne is a true digital health champion and leader. It's been a pleasure working with her now for a number of years. So Anne, the floor is yours if you can present the findings of this report so that we set the scene to this session. Thank you.
Thank you so much, Florence, for the wonderful introduction, and welcome to you all. It's very nice to see a full room. So it is my true pleasure to represent the findings of the Working Group on Digital Health from the Broadband Commission for Sustainable Development. The working group last year was chaired together with Nokia, as Florence said, and contained quite a lot of people from the commissioners, from different organizations, but also a lot of external digital health partners. In fact, the Broadband Commission for Sustainable Development is existing since 2010, is presided by President Kagame together with Carlos Slim and the Secretary Generals of ITU and UNESCO. So it is a very interesting commission where there are very inspiring debates, and yesterday also we had our annual spring meeting here in Kigali with a lot of interesting debates how ICTs can accelerate the achievement of sustainable development goals. This is a picture of the working group on health who worked together on this report last year. As you can see, all the partners in there. And the findings, we were in fact very much amazed that, first of all, we know that digital health has a really big promise. You can do a lot with digital technology in healthcare delivery, in health system management. You increase the quality of care, you increase the efficiency of care, you can decrease costs. Very importantly, you can pinpoint where the weaknesses are in your system with digital information and then address those. You can use real-time data instead of waiting for reports with data from 2 years ago, you can plan your health system according to real-time data. So there's a lot of promises and potentials of digital health to improve your health system functioning. And not in the least is the power digital has to give patients and their families much more empowerment and responsibility to take that up for the management of their own health. As long as the patients can be much more involved, the results will be much more promising of complicated treatments. So the report was based on a complex number of interviews with many country representatives of different countries working to get a national strategy together. But in fact, we selected 8 countries as case studies, really national case studies, where ministers of health and ministers of ICT had been working together to figure out how to realize that potential of digital health. And the case studies range from Norway to Canada to Estonia to Mali, Nigeria. Rwanda here was one of the star case studies, and you will hear more about it from State Minister Patrick here to my left, and going to Malaysia, Philippines as well. So all of these case studies were not only described in detail for other countries to learn from them, but we also looked at what are the common findings, what are the common success factors for countries to realize the full potential of digital health. We saw and we know from all the registers and the atlases that ITU, WHO is working on that a large number of countries, like 69 countries, do have e-health or digital health strategy, but it doesn't mean that they all have it implemented. Having the strategy that lies in the bookshelves is also not useful. So we have to look at how many of those countries do really implement it. And what we found, to keep the long story short, but it, as you see, the case studies ranged from high-income countries to low-income countries, and it was striking. But every country had the 3 same success factors for realizing the full potential of digital health. And it's nothing shocking, but it was so surprising that every single country told us the same thing. First of all, you need very strong visionary leadership with sustained, committed support to digital health and sustained financing for digital health. Secondly, and this comes as no surprise, you can see that countries with that visionary leadership have realized the potential of digital health. The second factor is that you need to have effective mechanisms to bring together the different sectors, because not a Minister of Health by themselves or the ministers of ICTs by themselves can solve the problem to make digital health used in the way it can be most useful. It has to be an intersectoral collaboration. So ministers of ICT have wonderful solutions, and ministers of health have enormous health priority problems which they don't know what solutions could be the best fit. So as soon as both expert ministers start to talk together, the solutions become reality. And the third success factor for national digital health strategies was that you need a national framework, for a national ICT framework for interoperability, for setting the standards, the regulatory framework, and the legislative framework. So these 3 things, you could say, simple, good business, but it's very easily said and not easily done, as you will hear from many of our colleagues in the panel. The way the countries do achieve it, it doesn't really matter. That was also an important finding in our report. Some countries have the health ministry in the driving seat and call upon the ICT minister to, or the ICT departments to bring in the necessary technical capabilities. Other countries plug into an e-governance system where the government has decided to digitize all of the departments, and then the health ministry can serve and leverage that e-governance system. This also works very well. Other countries decide to have the digital health part managed and designed by an independent agency, completely outside of the ministry. And that is called a specialized digital health agency mechanism of realizing. And that also works very well. Now, what is definitely true is that this is not static. One country can very well evolve between one of these models. So a country can start with the Ministry of Health in the driving seat, and in the meantime, the government has decided to establish an e-government, and then the mechanism of addressing the needs in digital health can shift. So there is definitely an evolution possible. And that is about what I wanted to say about this report. The three main findings are so strikingly the same for every country again, and the way the countries reach it, it doesn't matter. As long as there is this intersectoral collaboration and the national framework set, then there is a reason for success. Thank you very much.
Thank you very much, Anne. So one little thing that I did forget to mention at the beginning of this panel is, as you can see, all the chairs are not occupied. We're missing two esteemed panelists who are still with the Smart Africa Board, so hopefully they'll join us on time. Anne mentioned that the Rwanda case study in our report last year was a bit of a star case study, and before I introduced you to our esteemed panelist who's here to speak for Rwanda about this, I thought I would add this little anecdote. I presented this report and namely a little more detailed sort of the governance system that existed here in Rwanda on digital health. And Patrick is going to tell us more about this, but I literally got a request, just so you understand, from the Ministry of Health in France, which is my home country, to come explain that. So there is this notion, and we observed this when we did the global study that Anne Hertz just mentioned, that there's leapfrogging possibilities here in this area, which are really, fairly astounding. So now what I'd like to do is introduce you to Honorable Dr. Patrick Nimbumbanzi, who is the Minister of State for the Ministry of Health here, in charge of public health and primary health care. Thank you so much for being with us. You are a true example in what Anne was just describing. You're also a public health specialist. Just a couple of words also about you, with experience in designing and implementing strategies to tackle HIV, AIDS, pandemic, and other infectious and non-infectious diseases. But I think most importantly for the context of this panel, you have been very deeply involved for many years in the digital health strategy. So it'd be wonderful if you could tell us a little bit about that. Where do you stand, in fact? Because you, and we'll hear the case of Benin, who's not yet arrived early, who's just finalized their digital health strategy, but Rwanda has been in implementation mode for many years. So the floor is yours if you can tell us what the experience has been like.
Thank you, Florence. Good afternoon. It's a pleasure for me to be on this panel, and it's a pleasure to be able to share Rwanda's experience. As Anne was saying, leadership matters. Leadership makes a difference, and everything that happens good can put it on leadership. And sometimes anything that happens bad, you can also put it on leadership. So what we've done in Rwanda for the last, I would say, 10, 12 years, is to understand that ICT and digital health can make a huge difference in care, in provision of services, and can help us attain some of the key health outcomes. And as you know, we were one of the countries that were able to reach the MDGs, and we think that it's mostly due to the integration of ICT in our programs. For instance, I can tell you about the Rapid SMS. Rapid SMS is a platform on using feeder phones where community health workers identify pregnant women who need any urgent services and report it at high level so that the pregnant woman gets services easily and fast enough to save her life and her babies. But the leadership is not the only thing. As Anne said earlier, it's also the governance around that matters. One thing that we do in Rwanda, and it goes beyond ICT and health and everything, is that any policy document, any policy that we want to issue has to get approval from a large, wide consultation. So we call it the policy dialogue. For the policy dialogue, you need to bring in all the partners that are involved in that specific activity that we want to conduct. For ICT, if you have a policy or the policy that you're using that's back from 2009, you will bring all the partners, meaning the Ministry of Health and its agency, RBC, ICT and its agency, now RISA, it used to be RDB. You'll have academia, you have a center of excellence here, and you have also the developing partners or some NGOs that are involved in the sector. Like now we have plenty of NGOs, CDC, GPIGO, some others who work. You bring everybody on the table and you say, look, this is what we're going to do. You sit down, you think it through, you develop a plan together, and then you implement together. That has value because when it gets to implementation and monitoring, everybody has agreed on the same thing. So that's how we were able to develop different systems. And we're not yet perfect because some of the systems don't speak to each other yet, but that's not an issue because that's only a technical problem. Once you have somebody who's technical enough, he can make them speak the same language. So we developed a good amount of systems. I could say the system that manages drugs, the system that manages human resources, the system that manages the EMR, the patient's records, and so on. We have 13 different systems in the health sector here. And they are very helpful because they allow us to generate data that we use to take decisions, but also to run efficiently our system, which, as you know, is always increasingly expensive as people demand more and more services. So that's what I say. But we also have, beyond the technical working group, we have a steering committee that meets on a regular basis that looks over what has been accomplished. Right now, we are trying to write a new strategy for the years to come. And we were supposed to meet recently. But as you know, the IT sector is a moving target. It's so dynamic. It changes constantly. So we need now to decide to pick what works, not necessarily the state of the art. And that's what we came to realize, not necessarily the state of the art, but something that serves the purpose that we are pursuing so that we get the results that we want. Because it's not in our sector that we need to have the latest technology. We need something that serves you and that serves the purposes. That's what I can say in a nutshell, and I'll be happy to share more experiences as we go. Thank you.
Thank you so much. Can I can I ask you to describe just a little bit more the governance system that you put in place, because it truly is an example. I mean, I've gone to many countries trying to break the silo between the Ministry of ICT or Telecom and the Ministry of Health, potentially also with the e-government agency, and it's really a hard thing to do. How did you make that happen here? How does it work? And can you go into details? Meaning it's a co-investment, right? It's a co-investment financially. It's also a co-investment from an expertise standpoint. If you can give us a little more information so we visualize that a little bit better.
Thank you, Florence. Maybe I'll give the specific detail of the plan that we're developing now, the new strategy that we're going to develop. It all starts with a vision. Everything starts with a vision. Our vision was 2020 that we'll be a middle-income country. And all the policies that we have in this country stems from that vision. For the ICT area, we have what we call Smart Rwanda. Smart Rwanda, where you have 7 different pillars, and health is one of the pillars. So from there, once you know where you want to go, and they are saying this morning, somebody who doesn't know where he wants to go cannot get lost because you have no direction. when you know where to go and when you can be lost, you have things to track. So once you have the Smart Rwanda, all the strategy, the health sector strategy, are built based on the Smart Rwanda. So immediately there is alignment. There is alignment for the health sector, but also for all the other sectors. And we were saying it's my ICT, it's the ICT ministry, and the health ministry. I wouldn't go beyond. It's the whole of a government. Because in health, we use data from social protection. In health, we use some other data that's coming from local government as well. So it's not just the two ministries. It has to be the entire country. So once you have that vision and that directs, you have the ministry that is in charge of that. That's the Ministry of ICT. But for specific, for each ministry, you'll have the technicity that comes from the ministry that have expertise in that area. That in our case is the Ministry of Health. You go and sit together. What do you see? How do you sit together? There's a structure that says that you have to have a technical working group for various issues. There is a standing technical working group for e-health. That's one of the many technical groups that are in the Ministry of Health. That technical working group meets on a regular basis. That technical working group decides on what's next based on the policies that are in place and the strategies that are in place. So now what we are doing is that we have, for instance, a draft strategy that we're going to use for the next 5 years that has been developed by the technical working group, but that's reviewed by the steering committee. The steering committee that's chaired or co-chaired by the Minister of Health and the Minister of ICT. So when that document came to us, we said, no, you produce a good document, you work with all the partners, we work with all the people who are involved, but it's not good enough for us. So it's not forward-looking. You didn't put everything that we wanted to see. We don't see how it will help us leapfrog and reach the universal health coverage, because that's the target that we have. We don't see how with this we reach the Sustainable Development Goals. So we say, okay, go back, sit down, and show us how this is going to propel us where we want to be. This is the stage where we are. So that's the governance that we implement, where all the sectors get together and say, where do we want to be and where do we project us in the near future?
Thank you very much. So your steering committee, which is where it is such a wonderful example, Wanda, where you truly have a co-sharing of both ministers. They're both steering together at the same level, which you don't see in all the models. Sometimes it's the Minister of Health who leads, and then it's more parallel, kind of thing. And I think this true co-sharing that you have here is really a factor of huge success. Another thing that you didn't talk about, maybe we won't stay too long on it, but I think it's very important information that people need to understand is the investment, because we're talking about roads here. We're not talking about in the 7 pillars of a national digital health strategies. You have the infrastructure, you have human resources, you have interoperability standards, laws. So we're really talking about you building the roads versus just building solutions, right? And how we've been fragmenting the system, in fact, for many, many years. And that requires a very different type of investment than investing in an application or even an EMR. An EMR is an actual application as well, right? Can you tell us how much Wanda? What was the investment cycle? I remember the number on top of my, but I prefer you share.
Yeah, thank you. No, you're saying right. We're building the roads, and we are building the system, the architecture. One thing that's important to note is that as the ministry, as the government, our major role, the major role of being it my ICT or my tech or the Ministry of Health, our major role is to set up the policies and do the monitoring. So when we say setting up the policies, is that we need to make sure that there is alignment, that there is coordination, that there is harmonization, that there is regulation, and that there is streamlining so that we avoid we avoid duplications of any system. That's our major mandate as the ministries. We also do what we call resource mobilization. So we mobilize. The government invests a huge lot of money to build up the infrastructure. As you will know, Rwanda is one of the few countries where you have the fiber optic running all over, and that helps connect the health facility to the system, the health centers, the hospitals as well. And that's already done, and that's one of the huge investment that has been made to allow that. But we also leverage it with partners who invest in some of this area. And when I was looking at the numbers, those are huge investments that are counted in millions and millions of US dollars.
Yeah, on top of my head, I think if I remember from our little case study on you, you invested $35 million in the first 5 years of the implementation of your strategy. And then I have the number also that in Gabon, for example, there's a national digital health strategy being invested, and there's about a $50 million figure that's been put on that. So it's a very different world than what we've naturally been investing in, which are just pieces of the puzzle. I'm simplifying here to make my point, of course, but I think it's very important that people understand that, and also development banks. I don't know if we have any in the room right now, but many of the donors or the investors have, in fact, without the intention of doing so, been fragmenting the system. So because we've been investing only from the bottom up, versus sort of also we need to just look at it also from this top down, but it does require a very different kind of investment and a long-term view also on the returns on investments that it creates. So.
But I didn't want to go into the numbers because the return on investment is
important.
also huge. The return on investment, you invest a lot to build up the infrastructure, but the return is very huge. You invest a lot and you get more money.
Yeah.
Thank you.
No, in fact, it's a very important figure, that the one that came out from the report last year that I'll say just very quickly. Canada invested in a national digital health strategy. In 9 years, they calculated a return of $16 billion, knowing they invested about 4. So it was multiplied by 4, their return on investment that they estimated. So it's not negligible. Unfortunately, we don't have enough of those figures out there. So that's part of the monitoring and evaluation plan. We're going to now give the floor. Perhaps we still are missing our 2 other esteemed panelists. I don't know if Noel or someone can give us an update on whether they're going to join us at some point or not. But as a result, what I'm going to do is give the floor now to Dr. Olusayo Oluseun. I hope I'm pronouncing this with perhaps a slight French accent. And so Dr. Olu is currently the WHO representative to Rwanda. Just a few words about him. He has over 25 years of work experience in several organizations in Africa and Asia, including actually the Ministry of Health from Nigeria and international agencies such as Médecins Sans Frontières and WHO. And he was very involved also in Ebola's problematic in Sierra Leone. And Dr. Olu, you have also become a true digital health champion, so we're thrilled to have you with us on this panel today so that you can share your passion and also your experience. Thank you very much. The floor is yours.
Thank you very much, Florence. Let me, first of all, thank the organizers of Transform Africa. When I saw the agenda and I saw that digital health was going to be there, I was really excited. And I said, this is it. We are going to be heard, and we can say, what we think about digital health from the heart. Secondly, I think we have in the room our big partners, ITU. Sorry, can you hear me? ITU, who we have worked with closely. So I would also like to thank them and also acknowledge the collaboration that we have. For us in WHO, we believe strongly that digital health is the future, is one of the key tools that we need to deploy to achieve the SDGs, especially the health-related SDGs. Nevertheless, we feel that digital health must be deployed in a way that is sustainable, so that, it's not just a project that ends and then that is it, in a way that is cost effective. I think this morning, one of the questions was around how cost effective are the solutions. And we need to ensure that, given the fact that in Africa, a lot of our governments are running on tight budgets, digital health solutions must be cost effective. They must be context appropriate. They must be able to fit into our systems in Africa. Most of the areas where you go, you see we have issues with power, we have issues with, even when the internet connectivity is there, it is slow. So we must have solutions that will be able to adapt, to this kind of condition. Importantly as well, and I think most of the speakers before me alluded to the issue of interoperability. This is really critical. If we have several pilots that run on different systems, then we will have a lot of challenge. Because what we're selling to government then is like, they may end up having up to 10, 15 systems which are not communicating. So we believe that there has to be interoperability. So for us, as WHO in the African region, in collaboration with our partners, we have been working on a number of projects to address some of these issues which I raised, and I would like to share those with you. First and foremost, I think in terms of e-health strategies currently, from what my colleague Derek presented, I just got a little bit an update. We have about 53% of our countries in Africa that are, that have strategies. And not all of them are implementing, actually. A lot of them are there, but they are sitting on shelves. So we really need to operationalize those, and we need to ensure that those that have not developed are developing them. So in collaboration with ITU, we actually recently signed an agreement which looks at 4 key pillars. The first one is capacity building. As you know, if you look at the healthcare worker sitting in my village, in fact, don't let me go to the healthcare worker in my village. In this room, I see a lot of people with smartphones. How many of us really know how to use those smartphones properly? I see a lot of people with iPhones, which can actually measure a lot of parameters on you, but we're not using them. So this is one critical area where we feel that we need to provide the support. So the first pillar is looking at building capacity, and that capacity building is across the board. First of all, it looks like at the top level in terms of building capacity of the leaders for advocacy, building capacity of the leaders for strategy development, coming to the operational level, building the capacity of our healthcare workers. Our healthcare workers are trained mainly to do health. So if you give them digital health solutions, it may be difficult for them. So we really need to train them around, being able to use some of the solutions which we are going to, propose to them. The second area of our work is interoperability. Like I've said, several systems, looking at different things, DHS, looking at mHealth, looking at, data management. We need to create, a single platform at the national level, which can actually support a lot of these systems. So the second pillar is actually looking at interoperability and how we can use that to, develop systems at the national level that every partner that is coming in can actually key into. The 4 key areas, this third one is the partnership. I think we've spoken about the fact that digital health is sitting within the nexus of 2 main sectors. And when you look at these sectors, they are kind of specialized in their own area. So the guy in health knows a lot about the disease, knows about NCDs. The guy in ICT has the technology. So we're trying to build or to bridge that gap so that these 2 communicate effectively and they work effectively so that we can have a harmonized system that is well coordinated. Of course, we also want to look specifically at some health areas. So for instance, how can we use IT to actually resolve some of the health issues we have? I give you a very good example. If you go to see a physician now, he will write you a test, You go to the lab, you give your paper, then from there you get a test, it's done. Then somebody has to go pick the result and take back to the physician. That takes a bit of time. For instance, during the Ebola outbreak in West Africa, this was the most difficult issue because we needed to really diagnose people quickly and give the result to their doctor so that we can take a decision. So one of the key areas where we're working in collaboration with ITU is to look at how can we improve upon this. So for instance, a lot of those laboratory equipment can actually be connected online, such that a doctor sitting in Kigali can actually order for a test in Nairobi, or a doctor in Nairobi, or a doctor in Cyangugu, a rural area of this country, can actually order for a test in Kigali here. And once the sample gets there, within minutes of the test being done, he gets the result in real time and can take a decision on that patient. So that is one of the key areas. And we have a lot of other equipment, a lot of other issues. For instance, radiology. If you look at a lot of our countries, I spent a bit of time in South Sudan, where it was just coming out of, the country was coming out of war, and a lot of the doctors in the country were in the diaspora. So diagnostic, like radiology, was a problem. So in such a case, you could actually, you don't need to have a radiologist sitting in Juba or sitting somewhere. He could sit remotely, but the X-ray machine that is sitting in Juba is connected, is put online, and we can actually share the result with people who can help us to make the diagnosis and give the result. Of course, one critical thing and a key message which I really want you to take home today: digital health will not exist in a vacuum. It has to exist within a bigger system. And for us in health, that system is what we call the health system. So, and I give you an example. If you have, let's say you're trying to put in place a system to manage data, the data has to be generated. It's the system, we only take up the data when the data is generated. To generate the data, you need a healthcare worker, you need the health facility, you need patients, you need to deliver services. So, digital health will not stand alone. Another very good example is the Rwanda drone program, which is acclaimed globally. It is a very innovative idea. But behind that system, behind that solution, there is a long system, a big system of people who will bleed a patient, the supply that you need to bleed that patient, and on the other side, when you put the blood on a drone, it arrives on the other end, there must be a healthcare worker to actually administer this blood to the patient. So one of the areas where we are also particular in general now as WHO is to strengthen that system. So, and I'm happy to tell you and to inform you that we currently have a project which is called the UHC Flagship Program, that is Universal Health Coverage. And it actually focuses on strengthening the 6 building blocks of the health system. I've spoken a lot. I think I should stop at this stage. I don't know if there will be questions. Thank you very much.
I'm sure there will be. Thank you so much, Dr. Olu. And I take the liberty to also mention the 2012 ITU WHO toolkit on building national digital health strategies, which was really seminal, that many countries in the world have used, in fact, to build the national digital health strategy. So that's been a fantastic tool that was actually put together early on by WHO and ITU. So it's wonderful to hear that there's an updated strategy and sort of a vision also for these common digital health platforms, which are absolutely key for the interoperability challenge that we face today. So thank you very much. What I'd like to do now, we were going to have 2 special interventions from 2 distinguished gentlemen, and what I'd like to do is to perhaps invite them to come to the stage to join us, since we're still missing our other 2 esteemed panelists, if you wouldn't mind. And I'd like to introduce them to the audience. Dr. John Gozie Ahukana, who is coming from Nigeria and who is a health commissioner. from there. So it's wonderful to have you with us, because Nigeria was also, in fact, a very strong case study in the report from last year, because Nigeria built also a very impressive national digital health strategy, which I believe they're in the stage of implementing now. So thank you so much for also being with us today, and we'd love to hear what your vision is and what you have to say about the subject as well. Thank you.
Right. I would like to start by thanking Florence for inviting me, even though I thought I was going to speak from the podium. And then also the leadership of Transform Africa for inviting Abia State to attend. Surprisingly, there isn't any official delegation from Nigeria, because I'm told that Nigeria is not a member of Transform Africa, which is quite surprising for me. Anyway, I'd like to share with you part of the digital health strategy that Nigeria has adopted. In doing so, apparently I will be speaking, making a general comment on the national, and then drill it down to the state, which is where I am actually representing. Clearly, by the year 2020, Nigeria did agree that we'll be using ICT for health to drive our universal health coverage. And so in trying to get that developed, strategy development was started sometime in 2013, and that involved a collaborative effort between the Federal Ministry of Health, Federal Ministry of Communications, the states, the local governments, and then some agencies of government. And the strategy was put up and then approved in March of 2016. Subsequently, the implementation phase was now entered into, and that implementation phase started since 2016, and it's supposed to get to 2020. Clearly, what has so far happened is that the Nigeria Digital Health Strategy is now in operation. There is an e-health governance structure that is in place, and that team is actually led by the Honorable Minister of Health and all the key players in health, including the state commissioners, that is at the national level, and then down at the state levels, you have the commissioners of health who are actually leading the team, but then obviously reporting to their governors. Luckily, today, my own governor is here, and he's actually speaking in yet another room. We do have a program management office, which is located in the Federal Ministry of Health, and the funding has largely come from the ICT for the Saving 1 Million Lives fund provided by the World Bank. That takes me to the Abia State experience. Obviously, I have a principal who obviously is gold towards keying into technology to be able to drive access for the large number of people, to have access to quality health care. And so tapping into the increasing teledensity in Nigeria, I'm sure not too many of us know that Nigeria has a population in excess of, at the moment, 179. And Abia State alone does have a population in excess of 4 million. And so Aba, one very big city in Abia State, which is where I come from, it's not, by the way, it's not a capital, has a teledensity in excess of 1 million. And so the governor felt that, well, we could actually use that number and then try and see if we can, through virtual telephony service, drive an increase in health coverage. And in doing so, clearly what we have been able to achieve is that, one, we've been able to widen the access, and then two, we've been able to give quality outcomes to health consultations, because these patients actually speak to doctors, not just any and any staff. We've also been able to impact on cost because just with this very simple call card, you're able to assess a doctor, and the charge is so minimal, so you're not paying any consultation fee or all that, just the cost for acquiring this. And then the next, obviously, is the cost for your medication. And very importantly, it's also giving the patients the choice of taking the responsibility for their health. Now, what have we done so far in Abia? One, we did enter into a private-public partnership arrangement with the Dialedoc. I'm sure if you look at the back there, you'll see our banner there. Dialedoc is an ICT company that Abia State did enter into partnership with. And sometime in January 2017, when Abia State ably hosted the 59th National Council of Health, which I'm sure Olu would have been in attendance, the pilot study, we just didn't start it. The pilot study was embarked on. It was a 6-month pilot study across selected primary health care centers across the 3 senatorial zones in Nigeria. And obviously a report was presented following that pilot in March. Because of the success recorded from the report that we were given, the state actually keyed in and decided to formally launch the Abia State Telehealth Initiative. It was launched with quite some fanfare. I'm sure if Shukbo is in this room, he was there on that particular day. The Vice President was in attendance, in addition to the Minister of Health and the Minister of Communication, together with their labor and trade and commerce colleagues. So clearly, Abia State became the first state to put to put action to words. As we speak, there are about 4 other states who are about flagging off their own telehealth initiative, talking about Ekiti State, Bayelsa State, and then Ebonyi State. And it's not been, I wouldn't say that we are 100%, with what we've done. Obviously, there are challenges, but then we do hope that having launched these problems will come up, and then we deal with them as they come. Some of these challenges I can say clearly here. Internet connectivity, which I'm sure one of the panelists here did mention. Of course, the issue of power generation. Nigeria perpetually, I'm so sorry to say, is still grappling with dealing with power issues. And then, of course, awareness. And then, very interestingly, cybersecurity. And I'm happy that at the morning session today, it was mentioned. And actually, sitting right beside me was a cybersecurity expert that we are now speaking to. Of course, the other thing and the final thing is training for our healthcare workers and in changing attitudes for them to be able to buy into what we're trying to do. Thank you very much.
Thank you. Thank you so much for having brought the vision also from what's happening in Nigeria. So we're thrilled to have had, in the meantime, our 2 distinguished missing speakers enter the room. So thank you for being here and being able to join us. Monsieur Zhao, since you're on the stage already, thank you for being part of this. Let me, just a few words of introduction. Mr. Hu Lin Zhao has been Secretary General of ITU since 2015. Prior to this election, he served 2 terms of office as ITU Deputy Secretary General, and as well as 2 terms as elected Director of ITU State Communications Standard Bureau. ITU has been very, very important for many, many years in the space of digital health. We mentioned throughout this session already some of the toolkits that you've provided for governments all along the years. So it's very important that you're with us today, and we would love to hear sort of your vision of today and for the future of what ITU is going to do with digital health. Thank you.
Thank you very much. Yes, IT is very, very important for many years in the past, but will be also very important for many years in the future as well. And ITU, as United Nations Specialized Agency for ICT Services and Technologies, we are committing ourselves to connect people, connect the world. And if you connect the people, you need to connect the people in health. You cannot connect people from hospitals. That will not be good. So we are working with our health workers, health experts, to look at this issue. For example, earlier time we talked about e-health, we talked about telemedicine, and at our big events like WISIS, World Summit Information Society, we put connecting school as a target, but we also put connect clinics, connect hospitals as our target. So ITU has worked very hard with medical experts for standardization of those modern systems for our healthcare. And one of our senior experts from the Standardization Bureau joined the WHO's standardization board to help to develop some kind of standards for medical systems. And also recently we strengthened our cooperations with the WHO. Myself, I went to WHO's Health Promotion Conference in Shanghai in November 2016. And we also organized jointly with the WHO that the minister from telecom side and the minister from health side during the WHO's General Assembly in Geneva. And this year, very soon, later this month, we will organize another joint sessions at the WHO. And we very much look for good cooperation with our sister organization, WHO. So myself, I went to see the Director General of WHO last year and invited him to join our broadband commission meetings. And he took this very important. And he, despite of his newly arrival at Geneva, and his family just moved in to Geneva, and he just came to New York to join our broadband commission meeting in September last year. And he tried to join us this time, and he told me, because we had a meeting together last week at London at a CEB meeting, and he regretted very much that he cannot join us today to launch this good project for Africa Alliance for Digital Health Programs. And we thank WHO for this good partnership. And of course, at ITU, we worked very hard, but also at some other occasions like Broadband Commission for Sustainable Development. I think that I have my dear commissioner there, and she took care of this health issue highly on the agenda of Broadband Commission, and she just led a working group on this issue. And we have another working group led by Korea Telecom to talk about the EPIDIX, the program. And we encouraged our operators to work closely with our administrations, with public authorities, to try to deal with the public diseases problems. That, for example, Ebola, that we worked with our Africa friends, operators, to deliver, toolkits to help people to deal with emergency situation, and to try to work together to overcome that difficult period. So ITU consider that public health is absolutely important. So that I remember that in Shanghai, 6 November 2016, we worked together with WHO, and I think that is Young Habitat to try to develop a smart city and health city. That is, if smart city without health, that is not so smart. So we consider that health is an absolutely important part of this smart city. And also with our moderator, that she worked with Orange, and that we had very good cooperation to encourage the Orange and Alcatel Lucent, that to address these public health issues, and she had played a key role to facilitate this kind of thing. So I'm very pleased to see her here. I don't know that she was here for this panel. And I'm sorry to be late because I joined President Kagame for Smart Africa board meetings. We started from 2 o'clock, but unfortunately we cannot finish earlier. That the minister from Benin was with me, and then we tried to squeeze, but we cannot because the meeting continued, and then president is on the podium that we cannot leave earlier. But it's great for me to join this session, and I'm very pleased to have a chance to talk to our health ministers and the other partners, and to see how can we work together to take care of these important issues. Thank you very much.
Thank you so much, Mr. Zhao. I was just thinking, thank you for your kind words also. And I was just thinking this session is actually about, the importance of leadership at the government level, in order to scale digital health and get digital health to scale up. So it means the world to us that you are here in person representing an important institution like ITU that supports digital health, because that's a sign of leadership right there. So thank you really very, very much. I'd like to now welcome to the stage Honorable Aurélie Adam Soulé-Zoumarou from the Republic of Benin. Thank you so much for being with us. We're going to have you take the place of Dr. John. So we are also really thrilled to have you with us. First of all, you're representing also Francophone Africa, for one, but you've also just finalized a national digital health strategy. And so what we would love for you to do is to actually spend a few minutes to explain to us a little bit how you got there and what the plan actually is. And before you do that, I'm very sorry, I do want to say a few words of introduction about you, because you do come with a very long experience in the telecom and ICT sector. You worked actually with SFR, also with an operator who's very rich, Accenture, and then you returned to Benin in 2009, where you held a high-level position as the regulator at the ARCEP, and then you worked also with GSMA. So you come very, very, very rich background. And I can't help but also sort of mentioning, because I was very impressed by this, that you are working in parallel right now on a PhD from the University of Bordeaux, with a thesis focusing actually on deploying ICT services to rural areas in Africa. So congratulations for that as well. The floor is yours, Madame la Ministre. Thank you.
Thank you very much. Good afternoon, everyone. I'm very pleased to be here. And first of all, please allow me to commend the Smart Africa Alliance for the successful organization of this forum, providing us the opportunity to talk about what we're doing in our countries, respective countries. And I'm really pleased today to take you through our digital strategy in the health sector, so our e-health, cyber health strategy. First of all, let me tell you why we decided to have this digital health strategy. There are many reasons, of course, why a country can decide to develop a digital health strategy. I will stress on two of them. One of them is that in Benin, we have I would say a great recommendation on putting digital economy higher in our agenda. Our government action plan actually has identified digital economy as one of the priority area to work on, so that we can lead the other sector and also help them to optimize and deliver more efficiently. The president himself, President Talon, is the chairman of the Digital Council in Benin. So my mandate, I would say, is very simple, is actually to make sure that ICT is leveraged on all sectors, so including the health sector. The second reason I would say is that we just came up to a simple observation in the health sector. We have 12 qualified staff to provide health services for 10,000 people in Benin. 12 qualified health professionals for 10,000 people, while the World Health Organization recommends to have at least 25 qualified professionals for 10,000 people. So we are far away from this recommendation. That's why we thought that integrating ICT in the health sector would be helpful to help deliver good healthcare services. So those are two main reasons that I wanted to stress on the why. Now let's go to the how. How did we achieve this? How did we finally develop this digital health strategy? We took a multi-stakeholders approach. That include government, of course, the Minister of Health, Minister of Digital Economy, regulator, Minister of Finance, of course, and all the staff working with those ministers. The World Health Organization has been also very supportive, as well as the ITU. And we also had all the NGOs working on the health sector with us to do this digital strategy. We held several, I would say, workshops and also consultation process. We did, in November 2015, we did a workshop which actually brought 12 French countries to Cotonou on how to adapt ITU and World Health Organization digital health strategy guide. So that was the basis, actually the basis that we use for our work on this digital health strategy. Quickly, very quickly, so what is this strategy? What is it inside? We came up after those consultations, we came up with three main programs. Three main programs. One of them, the first one was on infrastructure, second one on e-services, applications, and the third one on the legal and also human resource environment area. So that's how we did this, this strategy. So those three programs were actually brought to 9 components, 9 areas to be developed, which led to 26 projects. So today in our digital health strategy, we have 26 projects that we need to implement. And here you can have some of those projects. For instance, in the infrastructure area, we have to build a digital network for the health care system. So to interconnect all the healthcare location premises, make sure they speak to each other, make sure we can provide remote healthcare to the area, rural areas where we don't have enough professionals. We also have to look at the legal framework. Recently, we adopted a digital code, le code du numérique, basically. And we have now to do a work we have to look at this code du numérique and see if in our health system everything is also taken into account to be able to provide healthcare system remotely, to be able also to have all those personal information protection, legal environment. So there are also work to do around that. In total, the digital strategy needs $21 million to be implemented. So, and that will be my main call today to the audience, is as if we know the destination, we know where we're going, we know exactly which plane to take, we know the routes. Now we need to buy the ticket. And the government is really willing to put money in implementing this health strategy, but we need, of course, we need support from all stakeholders, from international organizations. So please help us get on that plane and do this journey. And finally, I would like to invite you all at a conference that we will be organizing in June. a digital health conference that will actually bring ministers, ICT ministers, digital economy ministers, and health ministers in Cotonou from the 18th to 22nd of June to talk about digital health, to talk about safety and care in Africa using ICT. So you are all welcome to be in Cotonou in June. Thank you very much for your kind attention.
Thank you to you, Madame la Ministre, also for being so clear and concise. And I hope that anyone in the ecosystem here can have heard her plea loud and clear. Certainly, I will try to help from my end. So thank you again. I would have loved to move to a little bit more interaction, but I'm seeing the time tick. And we do have one more special intervention that we'd like to give the floor to, and would love to keep a few minutes also for questions from the audience. So I'd like to introduce you very quickly to Professor Gibson Kibiki, and we're thrilled also that you are here with us today because I should introduce you, Admina quickly, you are the head of the East African Health Research Commission. There is something very, very important happening in East Africa on the digital health front. And it's more of a regional governance sort of structure, and I'll tell you, I'll let you of course speak more of it, but it's wonderful that you're here because it complements nicely, right? Here we talked more about national governance. We also talked about regional governance when the Commissioner of Health from Nigeria explained how important that was as well. So let's get the perspective now from Professor Kibiki on what it can mean also at the regional level.
Yeah, thank you, everyone. Thank you, France. It's exciting to see how many initiatives are going on in the region, and I think we are really on the right track. If you see every country what is they're talking here, you know that something's happening. 5 years to come, we'll be talking a completely different picture. So let me also share with you the initiative that the East African community has embarked also in the same spirit of embracing digital technology into health. This is the East African community, just for the benefit of all of us, is that this is a regional economic community of 6 East African countries, that is Kenya, Tanzania, Uganda, Rwanda, Burundi, and South Sudan. And I know there are a few more countries which also are in the process of joining this community of about 170 million people and the GDP of about 170 billion US dollars, with a lot of investment opportunities, but also challenged, just like any other African countries, with health issues, workforce, major infectious and even non-communicable diseases coming up on top of the neglected tropical diseases. And so it came in a very interesting part, which is, I think, is important in leadership, because rarely, and my honorable minister here will tell me, that rarely ministers for finance, they sit together with ministers for health, because you know what ministers for finance were expected from ministers for health, that they're coming to ask for money. But in 2016, in East Africa, at the headquarters in Arusha, Tanzania, there was a meeting of ministers of finance, all from the region, the 6 countries, and ministers for health. And the agenda was, how can we really improve the universal health coverage and also position the region to achieve the Sustainable Development Goals of the UN. And when they meet, one side has to give money, the other side has to deliver the service. It was impressive. But what came out of that is that we need to embrace science and technology and innovation and the ICT. So from there, the East Africa Health Research Commission, of which I'm the head of it, which is responsible in guiding the region on such issues, providing evidence, and how to move forward. We carried out a series of meetings, consultations with various experts, including international experts. And from there, also we are supported by the scientific conference, which took place last year, which also one of the key recommendations actually was we must scale up use of digital technology in health to improve the health service delivery and also health outcomes. So after that meeting, we developed a concept, presented to the ministers, the council ministers of health, and it was approved. And we had a meeting in Uganda last year where we brought in all players in ICT and health, government officials, senior officials, international experts, private sector, faith-based organization, and the other experts. And we sat together and we discussed, is there a role for the region in this initiative? And unanimously said, yes, there are issues that can be addressed at a national level, but this region, being a region where now people are free to move and business is free to move within these 6 countries. As it was said by Honorable Zhao, I'm sorry if I pronounced it right, that you can't be a smart city if the health component is not part of it. You won't be really smart. So it was clear that with the free movement of people in the region, the health component, which is benefit and risk, has also to be taken care of. And therefore, we agreed unanimously that we have to develop a regional roadmap that will guide how do we institute digital health in the East African community. So we formulated a so-called now, which is official, a so-called digital reach. So we want to reach people digitally, but the reach refers to Regional East African Community Health Initiative. So this roadmap was approved again by the ministers or ministers of health and ministers of East African affairs. And I'm glad also to mention to you that in February this year, our presidents, the 60 presidents of the East African countries, approved this to be a priority for the region, and that we should develop a strategic plan for the coming 10 years, starting this year to 2018. So what has happened along the course is that we have, from the roadmap which was guiding us, where do we want to go, and whether really we are ready to go there, what will be the role of at national level, what will be the role at a regional level, and how we're going to complement one another and not to take for granted what has been done already at national level. So we're working now on the strategic plan, which will be complete in August this year, and we plan to have a donor roundtable towards the last quarter of this year. And then next year, 2019, we start implementation of the 10-year strategic plan. This time is exciting because this millennium, the world, we're going to experience some factors that are going to challenge the health sector, which have never challenged the world in this way. Globalization has never been as intense as it is today. We all know that you just need 2 days for one spot in the globe. If there is a disease, a deadly infection, for example, to go all around the world. We know the climate change that is happening, be it drought or floods, have major consequences in health, and we can better communicate. We can better tackle this if we use at least what we have currently is the digital tools. We know that the epidemics, the experience that West Africa had, and East Africa is not an exemption because Ebola was here in the 70s. So what are the chances? History is there that it can happen anytime. We know that the convergence of infectious diseases and non-communicable diseases that is happening in tropical countries, happening in an unprecedented scale that other parts of the world have not experienced, and the digital technology can help us really to move this agenda forward and see how we can overcome these challenges to a good extent. The antimicrobial resistant, how many antibiotics that used to be formidable to control infectious diseases, most of them are failing. And we think really we can do good surveys, real-time information, know what is happening, be able even to save most of the patients right on time. So it is out of these challenges that we think we have that we need to look for better tools that we have and continue to work. So our strategic plan is planned in a way that is going to address key areas: the enabling environment, the investment case, and also the coordination around that, and also health programs that are going to be a test of the enabling environment, but also to prove that really this is the game changer for those who have not converted yet, who don't believe that digital technology can make the difference. So we hope that is a regional initiative which probably is a pilot. We hope that all other African regions will also join this endeavor. The West African Economic Community, Southern Africa, and others, they'll join this. And as we continue, we'll be happy also to work together with all the other initiatives that we hear here, the World Health Organization, the ITU, and other economic communities and other initiatives from other countries, so that all of us, we can experience this. So thank you very much for allowing me also to share this experience. I'll be happy also to answer some questions if you have some. Thank you.
Thank you so much, Professor Kipiki. Very exciting initiative. There's no question. I was very lucky to participate actually in the meeting that you referred to in September in Kampala, and the possibilities of economies of scale. Actually, if you think about creating a larger framework on digital health, of cross-fertilization, there's even discussions on creating an African scientific cloud or digital, for digital health and everything. All of these things are very, very exciting. And again, I think also a possibility, again, for Africa to leapfrog in some of these. There's a lot of cross-border issues also, not only with data, but even if you look at the legislation behind digital health, like allowing, for example, for telemedicine acts. We've been doing a lot of interviewing for this new, actually up-and-coming Broadband Commission report on digital health. We're working now on NCDs, and we're getting a lot of feedback from on the ground where there's a huge problem still with that. So I think an initiative like the East African Digital Health Initiative can really help sort of try to move things forward a little bit, also from a legislative point of view. So thank you so much for having contributed. So we would love now to get a little interaction going with the audience and to see if you have any questions for or any of our esteemed panelists here. The floor is now yours. Thank you.
I'm from floor, I'm from podium. If you allow me, let me just add some additional information. I think that last year, ID organized Artificial Intelligence for Good Summit. At that summit, we got a lot of report or information from researchers that artificial intelligence could help us for the health, that they can develop a very good program to help the hospital to take care of the patient, and of course someone worried that if you have the machine and you don't need a doctor, they'll lose the job. But that I think that is possibility there. That is something we are. Next week we are going to organize a second Artificial Intelligence for Good Summit. Again, in that program from 15 to 17, so we will have someone to come to present their project on the health issues. That is a good thing that I'd like to share with you. Another thing is that with the industries, we got very good news that with advanced ICT technologies, we can use big data to predict the problems, eruption of the epidemics. These kind of things we are still at the early stages, but anyhow, I think that this news was widely welcomed by the public. That someone even said that we can predict eruption of perhaps Ebola sometimes again in the future, so that we will be very well prepared rather than at the last time we suffer a lot from that. So this information I just like to share with you before you open the floor for another question. Okay.
Thank you so much for this additional contribution. I see some hands raising. Is there a microphone in the audience? Yes, wonderful. Thank you so much. If you could quickly also introduce yourself before. Oh, the microphone doesn't seem to. Yeah.
Hello, it works here.
Here.
Hi, my name is Lauren. I'm from New York and I work at an economic data analytics company. I'm curious to hear a bit about the degree to which, honorable ministers are talking across countries to think about interoperability, of your data across borders and to be able to do big data analytics on the data you're collecting in your digital health systems.
Anybody? Question around big data analytics.
Should be somebody else. I think it's a tough one because we're still struggling with interoperability within countries. So across country, maybe I'll direct it to my friend. The EC, that's what he was explaining. The EC is making some strides, but now the whole of Africa, it's something else.
Yeah, thank you. We haven't yet started, but I'll tell you what we're planning to do. We want to have the regional East Africa Open Science Cloud for Health. And that will allow eventually the data flow in real time to flow to the regional platform and the analytics and all this eventually to use that data to be done. But, sovereign countries, they still have that sensibilities on data. So to us, we're going to start with implementation science. We have planned several programs. Franz just mentioned it, the cross-border programs. There are challenges with cross-border health issues. People live on different sides of the border, and they can't access services on all sides freely and legally. So we want to work on that and show that it can work. What needed is not data protection, it's data security and confidentiality, because that is where the problem is. We protect when in fact we need to just to secure, and therefore it can be available to everyone. We're going to work on that. When that works, then we can scale it up and eventually legislate, and it becomes a regional initiative. We start with few programs first.
I'll just add in one very, very quickly, that's what a national digital health strategy is about, is to create, the enterprise architecture so that all the data becomes interoperable and you can actually analyze it. I mean, that's, sort of the whole point behind it. It's very interesting because you're starting to see also sort of interoperable layers, that are able to connect sort of the existing data systems here in Africa. We just met with somebody who showed us the case of Ethiopia that's achieving great strides by just having sort of built this interoperable layer. And they have dashboards and they can analyze, sort of a lot of, it's very impressive. So I think we're not very far. But as he just mentioned, the data security and data privacy, which we talked about earlier, it's one of the pillars of a national digital health strategy. If you don't have that in place, it's very, very difficult to go far on that. And I see another, you have a microphone?
Really just to add on the discussion around data security, data protection. In ITU, there are two things that we are pursuing with member states. One is building cybersecurity legislation, because without legislation, nobody feels comfortable with letting their data on any cloud, leave alone medical data. The second issue that we are addressing is that of data sovereignty. Under whose sovereignty is your data when it is somewhere there? So that's an issue that we are addressing. We need the countries to be comfortable that if they have legislation in place, and on the other hand, it is harmonized legislation in the region, they feel comfortable that in case of breach, then there is a fallback.
I'm Patrick Kagenda from Uganda. I'm working with Strategic Information Technical Support, USAID-funded project. We've been rolling out an EMR, electronic medical record, in about 745 facilities in Uganda. things I want to basically learn from you, from Rwanda, is you go to a health facility, you have the equipment, and you've trained the staff, and you move on. Only to go back on tour monitoring, there are two things that happen. One, your equipment was packed almost literally the time you left because the electricity authority disconnected the health facility because they are not paying bills. And the other one is because it's an open source solution that is being encouraged, you find that one of those regional hospitals has upgraded the module that you put in there because it is open source. And now you are unable to roll out the other national modules which you put in. They say, look, we've invested a lot of research in this module, and now it is a higher version of a different version. So when you have these 15 systems that you're assuming to be interoperable at that point, then you find somebody has misplaced the structure, the APIs you had put in place. So those are, I really want to know, especially the open source part of it. The other part of the regional, having a platform where you do data warehousing and whole big data. I think there is an opportunity by UNAIDS under the Situation Room and being supported by UNAIDS to make sure that we're able to monitor all these key indicators from the main data sources like DHIS2 and the rest in the country. You're able to mine out the data. And we launched it in Uganda on 8th March, Women's Day. And you're able now to get data directly from these sources. It's not real time, I say, but at least you have a central place where you can get this information up to a time when we have the electronic medical records connected to electronic health records and then these other routine reporting. So I really wanted to hear from you how you're doing it as well in the country. Thank you.
Thank you, Patrick. My name is Patrick as well.
Clansmate.
So maybe I'll take the first part of the question about the EMR scale up and what are the mistakes or challenges in doing that. I think every country faces the same issues. But one thing, and it's good that we're talking about governance, one thing that's important is that your role or the role of the ministry is to get alignment and harmonization. And I was saying earlier on, there is no point in getting the latest state-of-the-art technology if it doesn't serve the purpose that you want. Olu said it about the health system and digital health. It cannot survive and thrive alone. It has to be part of the health system in general. Electricity, access, fiber optic, and so on have to be there and have to be in place. So to me, to answer to your question, one thing, don't go for the most fancy, go for the one that serves your purpose. Second, the ministry has to keep everything on control because these things are very, very dynamic. And lastly, it's very important also to have the human resources, not only the health providers who are trained, but also the developers who need to be trained and who need to be in sufficient numbers so that when you want to upgrade, they can upgrade. And finally, you need to have people who are convergent, who are as skillful in health-related, but also in ICT. So you need to bridge that gap, because if you only develop the health sector or the ICT sector, then at somewhere you'll find that it's not good enough because they are not talking to each other. It's another parallel system that will never work. Thank you.
Okay, thank you. Yes, I would like to build on what Patrick just said, the fact that it's important to have this junction between the ICT sector and the health sector. He rightly pointed out that if you have people in the ICT sector not understanding what is it to provide healthcare services, then you're missing something. And if the health sector people don't understand how they can use the ICT, the technologies, and also use the platforms to provide the same services efficiently, more efficiently, and save a lot of money. We were talking about Minister of Finance. Actually, the Minister of Finance, if the Minister of Health comes to him and said, I know how to save money in the healthcare system, I know how to do that using ICT, then the conversation is slightly different. And this is what we are helping them to do. Leadership in the implementation of this digital health strategy is important. So the Minister of Health is there, but Minister of ICT, of Digital Economy, is also there to provide the right, I would say, argument to have those this support from the other leaders as the Minister of Finance. And finally, I would like to, if you allow me, come back to the comments that were made around the data protection and the data security. Okay, being the Minister of Digital Economy, I would say it's important to look at it. It's important to have the right legislations. It's important, of course, to build cybersecurity systems. It's important to secure the data. But now, that being said, when I talk to my people in my village, in those rural areas, honestly, they don't care about protecting their data. They just want this health care system to come to us, to them, to allow them to be taken care of. They want to be, just to have the same type, the same kind of health care that we have in the urban area. I see people living in urban area more concerned about their data than those people who actually are left out of the healthcare system. So yes, we need to build all those systems. We are doing it. We will do it. But we need also, at the same time, to continue finding ways using ICT to get to those people that need the healthcare system the most. So that's what we actually trying to do in Benin, to have those, I would say, two-pace approach while we start to implement the digital health strategy. So that's what I wanted to point out. Thank you.
Thank you. I just wanted to touch on the issue of data interoperability across countries and to share an example of what we're doing in WHO. We have what is called the Africa Health Observatory. And we're working with a number of countries, I think about 8 to 10 of them, to actually set up their own national health observatory. And Rwanda is one of the countries where we are pilot testing this. So this system is such in a way that it pulls data from different sources. The surveys, the researches, and also the DHS. Now, how have we addressed the issue of data security? The security stays with the country. They are the custodian of the data. They upload data that have been cleared by government onto that platform. And that data automatically links up with our system in our regional office in Brazzaville. So we're able to pull data from different countries and in such a way that it can be used in the open community. Now, before we disseminate, the right to disseminate actually stays with the country. So, I mean, you say, look, you have provided us with this data, it has been cleared, can we share it? Once you click a button, then it tells us that it can be shared, and then it goes online. So this is another way in which we can, deal with the issue of, open source data and also data across boundaries. But like the colleague from ITU said, we need to build strong system for cybersecurity, because that thing can be sitting somewhere and a hacker can just go and hack it. So we really need to have in place this system, which again brings to the fore this issue of collaboration between the public and the private sector, and of course, the developing partners like us and the ITUs. Thank you.
Gabriel, just to say a few
Yeah,
words.
take our
I
time.
have several points. First, I think that this issue is public concern, and it's a public interest to really encourage everybody to work together. Now, from ITU side, we look for good cooperation with health experts, and from ITU, we look for good cooperation with WHO. And those projects that we launched together, like eHealth, mHealth, all these are just jointly initiatives. And as the Minister just mentioned, that ICT experts may understand technology well, but may not understand the need from the medical side, from the health side. That we need the health side experts to guide us, what kind of need they want, what kind of measures we have to take. Then we add the technologies to try to work. That is one point I'd like to add. Another one, we talked about the regional initiative. I think that is also very important, because sometimes the global solutions may not be applicable to the regional cases, or regional may have different expectations or priorities, while the global solution may not be there yet. And when you start a regional initiative, I'm pretty sure you will not start from scratch. You will try to understand whether we already have solutions somewhere else. We will not try to repeat those things. So that regional initiative, I think that we will normally cover the urgent need from the region. And that is I think that I do appreciate that if we have regional initiatives, that we have to go ahead, then should go ahead. And IT will support this. And another point I'd like to add is that I visited Benin March last year, and I had the honor to meet with the President of Benin and President of Parliament of Benin. And when I was there, they talked about their Parliament debate on the cybersecurity and on the other telecom laws. And then I was very pleased to hear from both President of Benin and President of Parliament of Benin that they consider that if we continue this way, they may not be always good for us, because ICT now is the power tool to assist all the socio-economic development ecosystems. That if we talk individually, that may not be the best way. So I was invited for the first time in my life to join group of ministers' meetings, including health minister, labor minister, education minister, and labor minister, and development minister. I think altogether 7 ministers. I think it's like cabinet minister meetings. And normally I could meet one. I could meet one or another in sequence, not together in the same room. But that is very good, because at that moment, Benin is trying to develop the national e-strategy to see how can we use the common invested resources to provide. Now, here you have also problems. We talk about the data. I can tell you that because of we noted that the privacy of the data, we talked about the security of data, we talked about, so that for good reasons, you may not like to share the data with the others. While you come together to try to work together, then you have to break the barrier of this. And that what we are facing today is something new to us, and we are trying to once more again work together and to make better use of ICT to assist all the ecosystem, in particular the health system. And from our Broadband Commission, I already got more and more requests that Broadband Commission for Sustainable Development should perhaps pay more attention to the issues with health concerned. So that one, we are looking for good opportunities, and with Director General of WHO, I think I have a much better chance to strengthen these functions to work together for the health issues. Thank you.
Yes, thank you so much. I just wanted to add one point, in fact, that it's very important to have this leadership, the national frameworks, the interoperable systems. But I would like to stress that what the State Minister of Rwanda was saying, use the solution that serves you best. Don't go for the state of the art in every case, because that will be outdated very quickly. And I would like to give you also the message before we go home, that it's not only about data in digital health. It is absolutely crucial to have real-time data to plan your health system properly on and to know if you're doing proper care. But what is the biggest potential of digital is that you can deliver services in another way. You can reimagine the way healthcare is delivered. And that is the beauty of this, which we didn't talk a lot about today, but I think Rwanda is a perfect example with offering telemedicine services. Ghana is a similar example with national telemedicine services, reaching patients where they need it most, using digital to do screening for chronic diseases that have no symptoms but are very dangerous to continue running around with, in non-traditional places like marketplaces, post office, whatever. So use digital for delivering services, for having a completely new way of delivering health services. That's what I think is the biggest potential of digital health. And let's not forget that. The data are obviously very important too, but the service is even more important. And I congratulate all the countries we have heard here today for everything they already can do with digital. Thank you so much.
I think we couldn't have asked for a more beautiful conclusion to this panel, so thank you very much, Anne. And we've also really ran out of time actually quite a while ago, so I think we should probably close this. It's been a long day, probably for everyone. So a big round of warm applause, I think, for our wonderful speakers here. Really thank you very, very much. And perhaps especially to Monsieur Zhao and Madame la Ministre, who had to scramble to sort of join us after, I'm sure, a long meeting. Thank you again also very much to the audience and for having been with us.